Several of you guys mentioned this, but what do you guys think about like telemedicine? I mean, that's kind of a big deal now where people have like an app and they can go on and talk to a doctor. And you guys mentioned something about like a picture. And so how do you think that kind of changes the way you can care for people?
So for us, we use a communication platform that allows our patients to see all of our messaging through the staff and me and my notes. And so it's very open to them, and they can message me anytime on there, and we commit to respond within 1 business day. So I'm not constantly bombarded by texts, and my patients feel that they can offlay their questions the minute they have them. So that's been really effective for us. I compare what we do to the go online and find a random telemedicine doc. It makes a huge difference when you have that relationship with someone and you know them well versus just jumping on and getting the doctor, whatever doctor is working for that telemedicine company that day. So I think we add a lot more value having that relationship and knowing our patients.
Just to reiterate that I can appreciate the question, and people in the audience or people online may understand the term telemedicine, but I get a little bit fired up. I try to say, look, I am not practicing telemedicine. I'm a direct primary care physician, and I'm using technology to my advantage. A telemedicine doctor or provider many times is some random person who does not know the patient somewhere across the country. They can't lay hands on them if they need to. And a lot of times, if they can't manage it, they just send them to the ER, the urgent care. So it doesn't really provide a lot of value versus what we do. We already know the patient. We know which ones are kind of holding back. We know which ones are a little bit over-exaggerate things. But using texting and emailing and those types of things, we can provide a lot of benefit, significantly more benefit than telemedicine providers. And lastly, I always tell my patients, since I'm not incentivized to see you in the office, I'm paid to take care of you. I'm not paid to see you. So if we can use technology to take care of you, and that works for you and it works for me, and we provide good care and everything's hunky-dory, that's what you're paying me for.